What if the third eye your ancestors spoke of is not an unattainable mystery, but a tiny gland in the center of your brain? And modern life is quietly changing its chemistry. Many adults show calcium deposits in the pineal on imaging. We cannot promise that every trace can be erased, but there is reason to believe that consistent, sensible changes to your environment, light habits, and daily practices can restore rhythm, improve melatonin function, and sharpen subjective clarity. This is how to approach pineal calcification with humility, curiosity, and a practical plan. Long before neurology had words for hormones and circadian cycles, certain teachers described an inner door, an eye of perception, a place where the soul and the cosmos met. Passages from late antique collections, texts scholars found at Nag Hammadi, and in writings like the Gospel of Philip, speak in symbolic language about inner sight and seals that obscure it. Treat those images as poetic maps, not medical diagrams. They provide emotional fuel and a moral frame. They remind us that bodies live in cultures and environments that can either clarify or cloud perception. Use that impulse, the desire to reclaim clarity, as motivation for evidence-informed steps toward better pineal and circadian health. So what is the pineal gland, in plain terms? It is a small pine cone-shaped structure deep in the brain that helps regulate melatonin, the hormone that signals night to your body. Melatonin helps coordinate sleep, temperature, and other circadian processes. As people age, and with certain environmental exposures, deposits of calcium phosphate, sometimes called calcifications, can form in the pineal. Imaging studies report that many adults have some degree of calcification. Its prevalence increases with age. The presence of calcification correlates with some changes in melatonin production in population studies, but the relationships are complex and not fully mapped. Where the evidence is strongest is in the link between light, timing, and melatonin rhythms. How you expose your eyes to bright morning light and how you shield them from blue light at night has a clear effect on melatonin timing and sleep quality. Evidence level, strong. Where evidence is limited or emerging is whether specific lifestyle or detox practices consistently remove calcified deposits visible on scans. Evidence level, limited to emerging. That distinction matters. We aim to improve function and experience first, with structural changes as a longer-term, more uncertain outcome. To translate the poetic 3 marks from ancient imagery into a working program, think of 3 pillars: origin, perception, command. Origin refers to the environment and what you expose your body to: the minerals, the water, the pollutants that can coax mineral deposition. Perception refers to light, sleep, and circadian hygiene, the daily rhythms that determine whether melatonin is produced on time. Command refers to activation practices, breath, meditation, movement, and habits that support autonomic balance and neuroplasticity. Each pillar is practical, non-dogmatic, and paired with evidence qualifiers. Start with origin. The environment you live in matters. Some agents in our environment can influence mineral balance and biology. Fluoride, for example, bonds with calcium in complex ways and is often cited in discussions of pineal calcification. Human studies have found fluoride accumulation in the pineal in some animal models and limited human tissue studies, but the clinical implications are not fully resolved. Evidence level, limited. What you can do, reasonably and safely, is reduce unnecessary exposures and support balanced mineral intake. Practical steps include using a quality drinking water filter where fluoride filtration is desired. Options like reverse osmosis or activated alumina filters can reduce fluoride in tap water in many cases. Evidence level, limited to emerging for pineal outcomes, strong for reducing fluoride exposure itself. If you live in an area where water fluoride levels are high and you are concerned, discuss testing and options with a local water authority and a healthcare provider. Diet also shapes mineral balance. Processed foods can contain phosphate additives that alter calcium phosphate dynamics. Reducing reliance on heavily processed convenience items can help your overall metabolic profile. Evidence level. Emerging with respect to calcification specifically. Strong for general metabolic health. Keep dietary calcium in context. Avoid extremes of supplementation without medical guidance. High-dose calcium supplements and imbalanced mineral intake can create conditions that favor unwanted deposits in tissues. Speak to a clinician before starting or stopping mineral supplements. Evidence level. Limited. Support antioxidant-rich foods. Bright vegetables, berries, spices like turmeric, and green tea, which contribute to cellular resilience. Evidence level. Emerging for neuroprotection. Well supported for general health. Reducing exposure to known environmental toxins, tobacco smoke, heavy air pollution, and occupational solvents is sensible for brain health broadly. Evidence level. Strong for overall neurotoxicity. Indirect for pineal calcification. Water treatment, dietary shifts, and mindful supplement decisions are practical, low-risk approaches. Avoid extreme detox regimens or chelation unless under clear medical indication and physician supervision. Some wellness communities describe aggressive chelation or unregulated protocols aimed specifically at decalcifying the pineal. Those carry risks and lack consistent, reproducible evidence for safe structural reversal. Evidence level. Limited to controversial. Use caution and professional oversight. The second pillar is perception, light, sleep, and circadian hygiene. This is the pillar with the most solid and actionable science. Your pineal does not generate melatonin in isolation. It responds to signals from the retina and a cascade of neural circuits that keep time. Resetting and protecting your circadian rhythm is the most reliable way to influence melatonin production and the subjective clarity often associated with a well-functioning pineal. Morning light matters. Expose your eyes to bright natural light within the first hour after waking for 15-30 minutes when possible. Evidence level. Strong for circadian entrainment. This can be as simple as stepping outside with a cup of tea, walking the dog, or sitting by a bright window. Light at the right time tells your brain when the day begins and anchors your circadian cycle. Evening darkness matters equally. Reduce exposure to blue-enriched light in the 2 to 3 hours before bedtime. Use dim, warm lighting and activate blue light filters on screens or wear amber lenses if screens cannot be avoided. Evidence level. Strong for melatonin suppression by blue light. Blackout curtains and removing small light sources from the bedroom, phones, LED displays, support the deep darkness your system needs to produce melatonin. For those who need night lighting, opt for very low, warm-colored lights away from the eyes. Consistent sleep timing is a foundation. Going to bed and waking at roughly the same times anchors the circadian system. Even if you cannot get extra hours, aligning your schedule consistently will strengthen melatonin rhythms. Evidence level. Strong. Avoid large meals and intense exercise right before bed. Both can shift physiology in ways that delay sleep onset for some individuals. Evidence level. Moderate. Temperature and timing can be allies. Cooling the bedroom slightly and having a warm pre-sleep routine, a hot shower followed by cooling down, can facilitate sleep onset. Intermittent fasting windows that align with daylight, restricting most caloric intake to daytime hours, are being studied for circadian benefits. Evidence is emerging but promising for supporting internal timing. Evidence level. Emerging. Practical guidance for light and sleep can produce quick, noticeable shifts in sleep quality and daytime alertness. Those functional improvements, better sleep, more consistent energy, fewer nighttime awakenings, are meaningful even if structural changes on scans take longer or remain variable. The third pillar is command, activation practices that support autonomic balance, neuroplasticity, and behavioral consistency. These are the daily rituals and micro-habits that create the conditions for physiological restoration. Begin with breathwork. Short, intentional breathing sessions influence the autonomic nervous system and support relaxation and sleep readiness. A simple practice to try twice daily, once in the morning and once before bedtime, is a 3-minute box of balanced attention. Inhale gently for 4 counts, hold gently for 2, exhale slowly for 6, and then rest for 2. This sequence supports the parasympathetic system and creates an internal sense of calm. Evidence level: moderate for autonomic regulation, emerging for long-term circadian effects. If counting is uncomfortable, practice comfortable, rhythmic inhalations and exhalations for 3 minutes, focusing on slowing and lengthening the out-breath. Meditation and focused attention help too. Short daily meditations, even 5 to 10 minutes, train the brain to regulate arousal and may increase subjective clarity and focus. Evidence level: moderate. Choose a method that fits you. Breath-focused, body scan, loving kindness, or simply a quiet noting of thoughts without engagement. Consistency beats duration. Daily small doses are more potent than occasional long sessions. Movement and modest cold exposure can be stimulatory tools. Light morning movement, walking, yoga, or aerobic motion helps entrain circadian rhythms and improve sleep pressure by nighttime. Evidence level: strong for general sleep benefits. Cold exposure protocols are popular in some traditions as a way to awaken the nervous system. Brief controlled exposures such as a cool shower or brief outdoor cold exposure can be invigorating. Research is mixed for long-term pineal outcomes, so treat these as optional adjuncts and progress gradually if you try them. Evidence level: limited to emerging. Cognitive and behavioral command habits matter. Regular schedules, social connection, and meaning-making activities reinforce circadian stability and psychological well-being. Keep stimulating cognitive work earlier in the day and create a wind-down ritual in the evening. Small signals, a specific cup of tea, dimming lights, or a short breathing sequence, become cues that help the nervous system shift states. For each of these activation practices, track subjective markers: sleep latency, number of awakenings, perceived daytime clarity, mood stability, and evening ease of falling asleep. These outcomes matter more than trying to self-diagnose tissue changes. Across the 3 pillars, here are crystal clear, safe, and time-efficient steps to begin tonight. If you can, step outside in natural light for 15 to 30 minutes within an hour of waking. Perception, evidence level: strong. Dim screens and bright lights 2 to 3 hours before bed. Use warm, low-intensity lamps. Perception, evidence level: strong. Install a drinking water filter that addresses contaminants you are concerned about. If fluoride is a worry in your area, consult local water data and a professional about filtration options. Origin, evidence level: limited to emerging for pineal outcomes, strong for exposure reduction. Reduce processed foods with phosphate additives and prioritize whole foods, vegetables, and moderate balanced mineral intake. Origin, evidence level: emerging. Practice a short breath sequence twice daily, 3 minutes morning and evening. Inhale gently, hold briefly, exhale longer. Command, evidence level: moderate. Sleep and wake at consistent times, even on weekends. Prioritize at least some daily light exposure. Perception and command, evidence level: strong. Supplements and adjuncts come up frequently in conversations about pineal health. It's sensible to know what people mention and what the evidence says, without treating supplements as magic. Melatonin itself is a tool for sleep onset and circadian phase shifts. Used judiciously under medical guidance, it can be beneficial for short-term alignment or when dealing with jet lag. Evidence level: strong for timing interventions. Use under guidance for chronic use. Magnesium, vitamin D, and antioxidants like curcumin are commonly referenced for sleep or general neuroprotection. Again, they should be considered as possible adjuncts rather than primary treatments, and only after consulting a clinician. Evidence level: emerging. Iodine appears in some lay discussions about glandular health. While iodine is essential for thyroid function, indiscriminate iodine supplementation without assessment can be harmful. Only pursue guided supplementation if lab tests or medical evaluation indicate a need. Evidence level: limited for pineal-specific claims, clinical for thyroid health. Be especially wary of protocols that promise to decalcify the pineal via specific over-the-counter remedies or high-dose chelation without medical supervision. Those carry potential risks and uncertain rewards. Some therapies occasionally discussed, such as high-dose chelation, aggressive detox cleanses, or unregulated intravenous protocols, are not recommended without clinical indications and professional oversight. The safest route is low-risk lifestyle change, attention to circadian hygiene, and measured consultation with trusted medical practitioners when considering anything invasive. Now, a brief experiential practice to anchor attention and support sleep and circadian regulation. This is a non-diagnostic, non-medical attention exercise designed to calm the nervous system and prime melatonin production. If you have any cardiovascular or respiratory issues, check with your doctor before changing breathing patterns. Find a comfortable seat or lie down. Allow your shoulders to soften. Bring gentle attention to the back of the head. Notice any points of contact with the pillow or chair. Let that awareness be an anchor. It is not a test, simply a focal point. Place one hand lightly on your chest, the other resting on your lap. Breathe in slowly through the nose for a count that feels natural. Allow a gentle pause, and lengthen the exhale so it's slightly longer than the inhale. Repeat 3 cycles, each time softening the jaw and letting the breath move deeper into the belly. After the 3rd exhale, rest the breath and notice a subtle quieting. If you like, form a simple intention. I will honor my night by protecting darkness and rhythm. Sit with the feeling of calm for a moment, then return to ordinary activity or sleep. This practice is intended to support autonomic balance and sleep onset. It is not a medical intervention and does not diagnose calcification. How will you know if your efforts are working? Track both subjective and simple objective markers. Subjective markers include how quickly you fall asleep, how often you wake, your daytime clarity and mood, and whether your dreams feel more vivid or restorative. Objective markers can include wearable sleep scores, total sleep time, and sleep latency as recorded by reliable devices. Consider keeping a simple sleep log for 30 to 90 days. Note wake time, bedtime, duration of morning light exposure, evening screen time, and a brief rating of clarity the next day. These small data points will show trends more meaningfully than one-off measures. If you suspect a medical issue, new or severe headaches, changes in vision, focal neurological signs, or seizures, seek medical evaluation promptly. Imaging like CT scans can identify calcifications, but imaging is a clinical tool and should be used under a physician's guidance. Routine imaging solely to check for pineal calcification is not generally recommended without clinical symptoms. Discuss concerns with an endocrinologist, neurologist, or primary care doctor who understands circadian health. Ask about appropriate testing and the limits of what images can and cannot tell you. Would you like a focused starter plan? Here is a safe, evidence-aligned 30-day protocol built around the 3 pillars. Treat it as an experiment in rhythm and clarity rather than a guaranteed cure. Day by day, general framework. Commit to the plan for 30 days and track sleep and subjective clarity daily. Daily commitments. Morning. Within 1 hour of waking, spend 15 to 30 minutes in natural light. Move lightly, a short walk or gentle stretching. Perception, strong. Morning. 1 3-minute breath practice. Command, moderate. Daytime. Favor whole foods, reduce processed items with phosphate additives, stay hydrated with filtered water if you choose, and avoid unnecessary mineral supplements unless advised by your clinician. Origin, emerging. Evening. Dim lights 2 to 3 hours before bed. Stop screens an hour before bed if possible. If not, use blue light filters. Perception, strong. Night. Keep sleep and wake times consistent within a 30-60 minute window. Perception, strong. Night. Bedtime breath practice of 3 minutes and a short body scanning relaxation. Command, moderate. Weekly commitments. 1 full day of light-focused activity. Longer morning sunlight exposure and earlier evening winding down. Review the week's sleep log on a chosen evening. Note trends and adjust timing or light exposure as needed. Optional adjuncts during the 30 days. Only with professional guidance. Trial of melatonin for short-term phase shifts or specific sleep onset challenges. Consult your healthcare provider first. Evidence level, strong for short-term use. Discuss magnesium or vitamin D testing and supplementation with your clinician if blood work suggests a need. Evidence level, emerging. What to expect during the 30 days. Many people notice improved sleep onset, fewer wake-ups, more daytime energy, and a clearer sense of focus within 2 to 4 weeks when they consistently alter light exposure and sleep timing. Evidence level, strong for sleep changes. Structural changes in pineal calcification visible on imaging, if they occur, are likely to be slower and variable. Do not treat imaging as the primary marker of success. Your subjective experience and sleep metrics are meaningful outcomes. If you try the 30-day plan, record started in the comments with your time zone. Community tracking can help you notice patterns you might miss alone. Sources and studies that informed these recommendations will be linked in the description for anyone who wants to read the clinical literature on melatonin, light, environmental exposures, and imaging studies related to pineal calcification. A few important cautions and clarifications before we close. First, while many traditions speak of an inner eye or a center of sight, those are metaphorical frameworks. They can inspire practices that improve sleep, attention, and well-being, but they are not a substitute for medical care. Second, some interventions touted online as guaranteed decalcifiers are unproven and potentially harmful. Avoid high-dose, unsupervised chelation or extreme cleanses. Third, structural reversibility of calcifications on CT is not well established in the research. The safest expectation is functional improvement, better sleep, steadier melatonin rhythms, and clearer subjective cognition, rather than guaranteed reversal visible on scans. Finally, remember why this matters beyond images and scans. The pineal sits at the crossroads of rhythm and perception, strengthening the day-night signals that reach it. Light in the morning, darkness at night, consistent sleep timing, and daily practices that calm and focus gives you a practical pathway back to clarity. Ancient teachers cloaked their guidance in symbolic language because they knew human attention is shaped by ritual. You do not need mystical rituals to benefit. Simple, repeated habits do the heavy lifting. Yet the ritualized moment, the breath held with intent, the cup of tea outside in morning light, reconnects you to a human scale of care. If you felt this message speak to you, subscribe to receive a detailed, referenced episode where I'll interview clinicians and review the primary studies that informed the plan. If you try the 30-day starter protocol, comment below with started and your time zone so others can learn from your experience. For any medical questions about imaging, diagnosis, or the advisability of testing or supplements, consult your healthcare provider. They can help you interpret tests and consider whether imaging or lab work is warranted in your case. Small, consistent changes to your environment, light exposure, and daily rituals create the conditions in which a brain structure like the pineal can function more smoothly. Reclamation is not an instant unsealing. It is a habit of tending. Begin with 1 morning outside, 1 evening of darkness, and 2 brief breath practices each day. Over 30 days, notice the shift. Over months, keep refining. The seal that once felt like destiny may, with patient, informed care, loosen into something like clarity. May your nights deepen and your mornings arrive with steadier light. If you want the science sources that back up what I've said, check the description for links to relevant studies and expert interviews. Go gently, stay curious, and report back. Collective experiments teach us what single well-intentioned efforts cannot.